Hi, everyone. I am delighted to welcome you to the UNICEF and Vital Strategies webinar on addressing climate and environmental risks to child's health using Children's Environmental Health Indicators, or CEHI for short. My name is Lynn, and I'll be the moderator for today's event. Some minor housekeeping before we get started. This webinar is being recorded, and we will be uploading the recording on a public platform for you to view or share with others. All participants will be muted throughout the webinar. However, we do have an opportunity for questions and answers toward the end of the webinar, and we welcome you to key in your questions in the Q&A box at any time throughout the event. Now, a quick run through of the program today. In a few moments, we will have brief welcome remarks from UNICEF, following which Dan Cass and Sunmi Choi will give a joint presentation on their pilot work around children's environmental health indicators and how that can be used as a tool to improve children's health in the region. Next, we will have two keynote presentations, the first from Fuyan Yip from the US CDC, and then from Marjin from China IPE. The session will then close with discussions and questions from the audience. As you can tell, we have a very packed schedule to squeeze into an hour. So without further delay, I'd like to welcome Myo-Sin Yut, Deputy Regional Director of the UNICEF East Asia and Pacific Regional Office, to give us his remarks. Over to you, Myo.
Thank you very much, Lynn. Good afternoon, distinguished participants, colleagues, ladies and gentlemen. A very warm welcome from Bangkok. UNICEF, as a child rights organization working for children, we are very much delighted to co-host this webinar, addressing climate and environmental risks to child health. This is an important as well as an emerging issue for all of us to address, as highlighted in our 2021 joint publication, Healthy Environments for Healthy Children, which you can download from the QR code and link on the screen. The environmental health is a serious threat for children all over the world, as 1 in 4 deaths in children under 5 globally is due to unhealthy environments where they live, where they grow. In terms of absolute number, we are talking about 1.7 million deaths. That's a lot of child death. And these are all deaths that can be prevented. So we all need to do more to avoid those preventable child deaths occurring. This issue is particularly important for this region, Asia and Pacific, which has the second highest death rate attributable to environmental factors after sub-Saharan Africa. Environmental health is also a social justice issue, as it often the poorest and the most marginalized will suffer the worst effects of the pollution and climate change. I'm looking forward to continue partnership with Vital Strategies, as well as building more partnerships and support with all of you for this course. I thank you very much for this opportunity, for being here, and I wish you a very successful webinar. Thank you very much, and back to you, Lynn.
Thank you so much, Myo. So now, before Sunmi and Dan go into more detail about the CEHI project, we have prepared a short video that gives an overview of the work.
Environmental degradation and climate change poses a threat to child survival, health, and well-being. It's time we put children's rights at the center of environmental health and climate action. Vital Strategies innovation creatively unites existing national and subnational data and integrates them with global evidence to create Children's Environmental Health Indicators Tracking Program. We piloted the program in China and Myanmar to track and identify climate and environmental health threats to children and to enable environmental interventions and policy evaluation. It's time we give our children the safer and cleaner world they deserve.
Great, over to you, Sunmi.
Great, great pleasure to join you all today. Let me share my screen. So hello, everyone. Huge pleasure to join in this important webinar that we're organizing with Vital Strategies. I'm going to give a brief presentation, mainly providing an overall global context on children's environmental health threats. Climate crisis is a child rights crisis. Climate change undermines the fundamental rights of the child as enshrined in the UN Convention on the Rights of the Child. Children's rights are being threatened by the global climate emergency, coupled with loss of biodiversity and pollution. As mentioned by the UN Special Rapporteur on Human Rights and the Environment, the right to a healthy environment could be one of the most important human rights of the 21st century. The latest scientific assessment from the Intergovernmental Panel on Climate Change also sent a very stark message on the current and future impacts of climate change, especially on health and well-being of children and most vulnerable populations. UNICEF's Children's Climate Risk Index that was launched last year shows globally 1 billion children, nearly half of the world's children, live in extremely high-risk countries from climate and environmental issues. Some of the biggest climate and environmental hazards affecting child health and well-being include water scarcity, floods, cyclones, vector-borne diseases, heat waves, air pollution, and soil and water pollution. Children, especially most marginalized and poorest children, are often exposed to compounding risks due to multiple climate and environmental hazards. The sheer magnitude of climate and environmental risks to children is really truly alarming. Over a third of children globally are exposed to heat waves. Nearly 1 in 6 children globally are exposed to devastating cyclones. 1 in 10 children are exposed to coastal flooding. Almost 90% of children living in areas with heavily polluted air. Children, especially in vulnerable situations, are affected by these multiple climate and environmental hazards, including girls and boys living in low-income households, ethnic minorities, migrants, informal settlements, and children with disabilities. We are also particularly concerned that children in fragile contexts, they are often characterized by disasters and conflicts, are faced with extremely high climate and environmental risks, as you can see in our Children's Climate Risk Index. To secure every child's right to a healthy environment in the context of escalating climate and environmental crisis, we all have a role to play. We have tools and knowledge to act. As identified in our Children's Environmental Rights Guidance, shown here, each member of the society and stakeholder groups, including states, civil society, businesses, children and youth, as well as media, can all be an agent of change for children's environmental rights. When it comes to health systems, UNICEF's Healthy Environment, Healthy Children program framework focuses on 5 areas of intervention, from climate resilient and environmentally sustainable healthcare facilities, climate smart primary healthcare, to mobilizing collective actions on environmental health. Together with health sector stakeholders, we also need environment stakeholders, industry, and all other sectors and parts of our society to join our efforts to go beyond fragmented, incremental, and sectoral actions towards integrated and multi-sectoral solutions to address increasing complex and compounding climate environmental risks to children's health and well-being. So we call for you all to join us in our collective efforts to prevent, reduce, minimize, and better manage climate and environmental risks to child health through child rights-based climate and health solutions. Children's environmental health data and indicators are part of the important tools to enable and accelerate evidence-based and participatory policies and actions. I am pleased to welcome Dan from Vital Strategies to share our work more concretely on children's environmental health data and indicators. Over to you, Dan. Thank you.
Thank you so much, Sunmi. Okay, go to the next slide. So thank you so much, everyone. Fundamental to the work we're discussing today is this reality. Governments, NGOs, and others collect far more data than they use, and even more so than they share. These quotes are by a range of data scientists, philosophers, and even an expressionist painter, and they capture the issues that we aim to address in our proposal for widespread use of standard indicators for children's environmental health. We're surrounded by data, but we're starved for insights. Storytelling with data enables it to become meaningful. Data is imperfect, but nonetheless useful, and simplifying data doesn't actually result in a net loss of meaning, but a net gain. Next slide. So let's start with indicators. We work with this definition. A children's environmental health indicator provides information about the relationship between a child's well-being and their environment. Of course, one indicator alone can't tell much about this relationship, but collectively they can. Next slide. And what in turn do we mean by environment? Well, Sonmi has laid out a challenge for all of us, which is to really think about it extremely broadly. For our purposes, UNICEF, along with the governments of China and Myanmar in our pilot program, we aimed for a broad definition. Children's health is determined by decisions and risks across many sectors: water, vector, air, maternal child health, climate, chemical exposure, the home environment. And these correspond to activities, policies, and data sources in many sectors: water systems, public health, environment, industry, mining, energy, forestry, city planning, transportation, sustainability. For the development of a robust set of indicators, we sought data from all of these sectors because they all influence a child's well-being. Next. Now, indicators can be grouped in categories, subcategories, subjects. They may be percentages or prevalence, counts, mean measures, incidents, which are counts over a specific period of time, or even monetary. In our work, several dozen indicators have been selected by stakeholders as high priority and achievable. And these are just a few examples. Next. So why do we emphasize indicators here? Indicators achieve several important aims toward our goal of telling stories with data about the well-being of kids. They simplify complex information. They're standardizable across geographies and indicators that can be described at international, national, subnational levels are the most powerful ones. Indicators, as we envision them for this effort, draw on existing data sources rather than depend on some future uncertain collection of new information. They rely largely on administrative and survey efforts already underway. Indicators are by definition aggregate data, and especially with respect to sensitive environmental information and confidential health information, pose no risk by presenting them publicly. Indicators aren't intended to solve ideological dilemmas, nor to prove causal relationships among exposures and outcomes. That's the work of research. Rather, indicators can generate hypotheses about those relationships. Indicators are also intended to be well understood by technical, non-technical, and lay audiences alike, and in the aggregate are capable of telling a story that no one metric or research study can do on its own. Next. The process of selecting and defining indicators can vary and can be informed by local contextual factors and by government willingness. But common to the selection effort are these objectives. First, they should represent a mix of topics that characterize risks, exposures, health outcomes, actions, and contextual factors like the socioeconomic or educational attainment of families, and vulnerability. Second, they should be selected based on available data. Ideally, in any given country or context, an indicator should also be resolvable at multiple geographic or administrative levels. We know, as Sonmi has said, that exposures vary dramatically by geography and social characteristics, as do risks. So the indicator should be chosen to calculate and illuminate those differences. Next. Now, in addition to these factors, we have to keep in mind the interests and incentives for data owners and generators to participate in this effort. Good indicators should add value to the work of data collectors and sharers. They need to be valid, meaning that they shouldn't claim to describe something that they don't. They should be selected not to point the finger of blame at any one agency, but reflect the reality that children's well-being is the job of everyone. And they should appeal, as previously said, to many audiences. Because risk and harm isn't distributed equitably, the indicators should strive to expose those differences and those inequities. Next. Doing all this is the job of many stakeholders. And here we highlight largely governmental stakeholders involved in our work in China and Myanmar. Note how broad the engagement is. In many countries, the work of NGOs and advocates and civil society organizations should also be encouraged and welcomed. Next. You'll be hearing shortly from Fuyan Yip from the US Center for Disease Control's Environmental Public Health Tracking Program, which to my mind is the best example of this kind of work globally. So I won't focus on the functionality of data visualization and analytic portals, except to say the technology is now so readily available and customizable that it enables very creative and economical presentation and interactivity with data. Strong data portals share several characteristics. And here I highlight what I consider essential and core functionality. These features, once an enormous coding and technical challenge, are now standard in any business intelligence and data visualization package. And note that the list is intended to appeal to people who readily consume quantitative data, people who respond best to charts and visualizations, and people for whom the consumption of data prompts demand for more information. Next. I'm going to end by encouraging you to review the document you've been sent, UNICEF and Vital's Guide to Promoting Healthy Environments for Children by Using Indicators. The guide is intended to jumpstart efforts by governments to create a children's environmental health indicator system. And we at Vital Strategies stand ready to support these efforts and to seek and link funding to countries poised to adopt this approach to protecting our most vulnerable citizens. Back to you, Lynn. Thanks.
Thank you, Dan and Sunmi, for that presentation. Again, a gentle reminder if you've just joined us that you are welcome to key in any questions you may have into the Q&A box, as we will have a Q&A session later. Before we turn to the keynote presentations, let's just watch a quick video by UNICEF China, who was a key stakeholder in the pilot run of the CEHI project.
With support from UNICEF's Regional Office for East Asia and the Pacific and Vital Strategies, we worked with Chinese universities and national technical institutes from health and environment sectors to create a list of children's environmental health indicators for China. Based on these indicators, we are currently cooperating with different stakeholders to strengthen national and local capacities in data collection, analysis, and dissemination to ensure environmental health policies and actions in China become more child-sensitive, leading to improved child health and development outcomes.
Now it is my great pleasure to invite Ms. Fuyan Yip to give her keynote presentation. Fuyan works at the National Center for Environmental Health at the US Centers for Disease Control and Prevention and provides leadership to national, state, and local level partners by collecting and applying environmental health data, conducting epidemiological studies, and providing support to environmental health programs and practitioners. In her presentation, Fuyan will share more about the Environmental Public Health Tracking Program. Over to you, Fuyan.
Thank you very much. It's a pleasure to be here. Thank you for the opportunity to present on the Environmental Public Health Tracking Program today. So the Environmental Public Health Tracking Program in the US Centers for Disease Control and Prevention strives to achieve its vision of healthy, informed communities by empowering environmental and public health practitioners, healthcare providers, community members, policymakers, and others to make information-driven decisions that affect their health. And the CDC Environmental Public Health Tracking Program consists of our national program and a host of partners, including state and local health departments, federal partners, national organizations, and other key groups. And our program currently funds 26 health departments, as you can see highlighted in dark blue, to build and implement local tracking programs and data networks. And like our program at the national level, they develop data tools, applications, and products to help inform public health action in their areas. And to help extend our program's reach, we also work with a national partner organization, the Association of State and Territorial Health Officials, or ASTO, to help unfunded health departments participate in program activities to help begin capacity. And our partnerships are vital to the tracking program. They support our ability to build a sustainable national environmental public health tracking network, enhance environmental public health tracking workforce and infrastructure, and also disseminate information to guide policy, practice, and other actions to improve the nation's health. So let's take a closer look at how the tracking program provides better information for better health. So we use our broad network of experts, data, and tools to connect environmental and public health information in one place, make it accessible to anyone, and also make it easy to share. So you can see here on the slide the extensive list of topics that the tracking program covers, from environmental hazards, exposures, and health effects, as well as population traits that contribute to or protect people from environmental health threats. And within these topics, there are more than 600 different indicators and measures on the tracking network. And one important feature is that many of these data are standardized so that they can be compared across time and space. And we bring these data together in one place from multiple data sources in collaboration with partners from across different sectors, from the national, state, and local levels. So our tracking program provides data and information that meet different needs and inform decision-making at the local, state, and national levels. Our flagship product is the Environmental Public Health Tracking Network, and that's a web-based, multi-tiered, interoperable system of data, tools, and services. And it offers unique data like emergency department visits and hospitalizations, visualizations, interactive tools, and contextual information. And you can access our data in a variety of ways. From our Data Explorer, there's topic-specific dashboards, API, which is the Application Program Interface, and also info by location. And you can also view the tracking program websites developed by our funded state health departments to explore data, tools, and resources that are important to their community. So let's quickly take a look at these tools. So this is the landing page of our National Environmental Public Health Tracking Network. And as I shared, you can access our data in a variety of ways. The Data Explorer, as you can see here, is our main data tool for users, and I'll show you that in a moment. But we also have other tools accessible via this landing page, including this info by location, which highlights our data as infographics and is accessible to a variety of audiences. So if you enter a county name or a zip code here in info by location, and I entered the one for CDC, then it quickly provides some quick facts for demographics and other relevant environmental health topics, including asthma, in air quality for the specific area that I entered in to the info by location tool. And then, as I mentioned, the Data Explorer, access through this route, houses all of the environmental exposure, hazard, and health data that I shared earlier. And users can access these data via this query panel. So if you click on the content area, you'll see the variety of data that are available for users to access. And depending on, so I'm going to go ahead and select asthma, and then you'll be able to select asthma-related indicators. I'll go ahead and select prevalence of asthma among children, and then a measure that's specific to this indicator. I'll go ahead and select crude prevalence of children under 17 years of age. And then you have an option to select the geography type, depending on the data available. For this data, it's national data by state. And the data available right now, I'll go ahead and select 2019. And depending on the data, you can also select age groups, gender, and race. I'll go ahead and just select all. And then automatically by default, a map is provided with this information, the indicator and measure information. And when you hover over, you can see this data. So this is just a quick example of the Data Explorer tool and the types of data that are available on the tracking network. But I also want to highlight that on this tracking network, I mentioned that our state and local tracking programs also develop their own local tracking networks and include data that is specific and relevant to their jurisdiction. So through this link here, you can access the different tracking networks that our state and city funded partners have provided. So the engagement of our funded US states and cities has supported and enhanced the practice of environmental health through tools that I just showed you and other applications of the data. So to share a few examples, our tracking program has been able to engage in data modernization, which is a CDC initiative that brings together state, tribal, local, and territorial public health jurisdictions, along with private and public sector partners to create modern, interoperable, and real-time public health data and surveillance systems to help protect the American public. Also, we've been able to engage with multiple key partners. Specifically, our funded health departments are required to actively collaborate with environmental programs and departments in their jurisdictions and other key partners such as colleges, universities, and community organizations. And through the tracking program, we've also worked to support workforce development by increasing staff knowledge and skills in data science, data visualization, and data communication, as well as program capacity by building resources and capabilities to adapt and respond to emerging issues, including and such as the recent pandemic. So the engagement of our funded US states and cities has helped to enhance the practice of environmental health that can lead to improved decision-making and influence public health. So to share two examples of how this practice can lead to improved decision-making and influence public health. The first is CDC's data modernization effort. The Environmental Public Health Tracking Program and one of our sister programs, the Water, Food, and Environmental Health Services branch, are working together to enhance and expand environmental health data modernization efforts across the country. And our two programs currently fund 11 projects from state and local tracking programs to modernize the collection, integration, dissemination, and application of local environmental health data. And these funded jurisdictions are working on a range of projects to improve the use and the dissemination of data related to environmental health services, including inspections, permitting, and also public inquiries, as well as complaints for food and private wells. So this initiative will help CDC and its partners chart a course to the future where data drives action in real time, efficiently, flexibly, reliably, and effectively. And on the right, tracking data has been used to inform policy change for regional heat advisories. Specifically, the New Hampshire tracking program, along with key partners from Maine and Rhode Island, evaluated the effects of heat on health across the Northeast region of the United States. And the data showed that the emergency department visits and deaths increased significantly on days when the maximum heat index is 95 degrees Fahrenheit, which is much lower than the 100-degree Fahrenheit heat advisory that was in place at that time. So the tracking program shared these findings with the National Weather Service and worked with them to revise the heat advisory threshold policy. So now the National Weather Service issues excessive heat advisories at 95 degrees Fahrenheit instead of 100 degrees Fahrenheit. And we've also been able to capitalize on our cross-sectoral collaborations to develop tools that integrate our standardized health data, environmental data, and population data in a variety of formats. So I shared with you the Data Explorer tool, and we've also brought together our data in custom dashboards, including an environmental justice dashboard and one focused on heat and health. While we developed some tools that can be used by public health practitioners and others who are already familiar with environmental health data, we've also designed tools with the public in mind. And we supplement these data with additional content that helps explain or interpret the data, why it matters, and what it means for our health. And we also create additional tools to help provide insights into characteristics of communities and populations that may be protective or make them more vulnerable during public health emergencies. We work closely with our national partners to obtain these data, such as wildfire smoke. So through the wildfire smoke tool, as you can see on the map on the top right, we're able to display locations of predicted surface smoke concentrations from wildfires. And then it can be layered on top of county and census tract level measures, such as access to care, social vulnerability, health status, annual air quality levels, or population characteristics. And we also added other overlays that you can add to the map through the Data Explorer that I showed you earlier, including current radar and weather, and transportation noise. And we also created different points of interest, as you can see with the map at the bottom left. The user is able to add points, including schools and hospitals, so that we can obtain additional information alongside the environmental health data. So as you saw, there's a lot of data that we've obtained through partnerships and in collaboration that can be accessed and visualized in different ways. But tracking doesn't stop with data display and dissemination. As you can remember, our aim is to provide the best quality data so that people can make informed decisions about public health. And tracking's expertise and data and tools have been used to inform decisions about allocating resources, planning interventions, and evaluating efforts to protect and improve the health of communities. So to close, I wanted to share a few examples of these successes as it relates to children's health. The first is California Public Health Tracking Program. They were able to use their environmental health data to prepare a report on agricultural pesticide use near public schools, and that report helped inform policies to reduce exposures. And in New Jersey, their tracking program provided useful and easy to access data for improved maternal and child health services. And in Massachusetts, they used their environmental health data to address parent concerns about health risks related to exposures to toxic vapors at a children's recreation site. And then last, in New York State, the tracking program helped New York's Cornhill community get funding for a park to create a safe and clean place for outdoor play and activity. So thank you again for the opportunity to present on the tracking program today. I'll go ahead and pause here. Thank you again.
Thank you, Fuyuan, for the excellent presentation. If you have any questions on that presentation, please do key it in the Q&A box. Now, it gives me great pleasure to introduce our second keynote presenter, Marjin. In 2006, Marjin founded the Institute of Public and Environmental Affairs, IPE, and led the development and launch of China's first environmental public database, as well as the Blue Map, a mobile app that visualizes air, water, ocean, and soil quality data to help the public monitor corporate emissions and other potential environmental violations. Let's hear from Marjin about his experience and how his efforts have made a difference in China. Over to you, Marjin.
Thank you. I appreciate UNICEF's invitation for me to join this very important discussions. And I want to share with you some of the efforts made in China to try to address environment and climate risks, particularly to the health of children through data transparency and technologies. Pollution is a major posed a major threat to the health of children in China. A few years ago, even the most modest estimate goes like up to 500,000 of premature death can be linked to air pollution alone, and 300 million people at that time lack access to safe and sufficient drinking water. So we believe that to resolve the problem, we need extensive participation, and access to environmental information is a prerequisite for any meaningful participation. So with that in mind, 2006, we founded IPE and began to build the prototype of the Blue Map database. Through all these years, along with our partners, with all the promotion and advocacy, we have seen an expansion of environmental transparency. And in China, historic progress have been made. Today, every day we're tracking 5,000 sources from all the agencies in different different levels to major platforms of corporate emitters and gather 3 million pieces of environmental data, emission data, and 1 million environmental quality data together. With the emission data, we put it into use to help cut emission and build a green supply chain program. And we're very happy to see some of the largest multinationals sourcing in China and also the local companies began to incorporate our data in their sourcing codes. And before they sign contract, they usually compare their list of suppliers with our list of violators. And here's a region in coastal part of China with a very densely populated. We can see how the water have been color-coded according to its level of pollutions, good for no use. And when we saw discharge point like this, we couldn't do much, but luckily some of the largest brands began to tap into our data and they identify this source as the emitter to be one of their major suppliers. And through collective efforts, they have motivated this company to upgrade its wastewater facilities and brought more than 10 million tons of water up to standards before they discharge. And through all these years, more than 17,000 large suppliers have openly addressed their violations and many began to measure and report their footprint. And China has also adopted a green finance policy, and based on the big data, we have developed a dynamic environmental performance assessment tool and color code more than 10 million companies based on their level of environmental performance and put them on the digital map. And we supported some of the largest banks in China and investors in the due diligence of environmental performance. And we also tap into the mobile internet and put all this environmental quality data from air to water to soil risk sources. On the water side, 20,000 monitoring stations, air side, more than 4,400 across China. And every hour, or on the water is every 4 hours, or on the manual monitoring monthly data. We brought them together and then create health indicators and to try to highlight the risks. And we're very happy to see through visualization of some of the bad violators, tens of thousands micro-reporting have been filed against violators, and thousands upon thousands have openly addressed their violations. This is one of the largest iron steel companies which used to breach the standards every hour, and through all these efforts, they managed to make a very deep cut of the emission. And through all these efforts, where the transparency have triggered a national clean air action plan and clean water action plan, we have seen a significant improvement. China managed to cut the level of air pollution in 8 years, by half in just 8 years of time. So from 2013 to 2020, we have seen PM 2.5 concentration in Beijing drop from nearly 90 to 38. And in some of the surrounding regions, they dropped by nearly 100 micrograms and annually. Can you all imagine the health benefit of that? Of course, further mitigation need to be coordinated with climate actions. China have made commitment to carbon peak and neutrality, so now from now on, the priority is to coordinate the two, and we believe all this helpful experience, like information transparency and multi-stakeholder approach and market-based solutions can be also very helpful to addressing climate risks. So we build the blue map for zero carbon and provide all this annual variation of discharge from provincial level to the city level, and based on that, build carbon peak and neutrality index to assess the performance of different regions. And on the corporate side, also accountability mechanism need to be built. So we built a climate action transparency index and use that to assess the performance. This year, it's going to be expanded to more than 1,000 listed companies. Happy to see China made new requirements for corporate disclosure, including carbon data, and we started compile the data and put it on the digital map. And to address the gap in carbon footprint accounting, we developed the digital greenhouse gas emission accounting platform and to cost effectively help all these companies to do it. Some of the largest banks also tap into this to drive those who want to borrow money to measure and report. And we're also developing, along with our official partners, to a life cycle carbon footprint factors database. And also, as an environmental NGO, we built a program, just launched a new tool allowing the consumers to take a picture to identify the embedded carbon footprints of the products. Of course, mitigation of the environmental and climate risk is important, but adaptation is also necessary. So when the heat wave is leading to more frequent rising of the ozone, for example, in recent days, we also creating new health risk tools to more precise tools with universities and partners to help address the risk. And today, 2 days ago, I was invited to join the policy and maker and civil society and business from Bangkok to discuss about the Thai clean air future, and very impressed by the newly elected Bangkok governor Chachat and the civil society NGOs, and so I can see that there is a real potential for all this cooperation, with America, with Europe, and also the South to South collaboration. Yeah, thank you very much for your attention, and I look forward to further discussions. Thank you.
Thank you so much, Martin. Before we head to the audience Q&A, I'd like to invite a special guest to share some of his thoughts. Dr. Bill Sook is the Chief of Hazardous Substances Research at the National Institute of Environmental Health Sciences at the US National Institute of Health. So Dr. Sook, I invite you to turn on your video and your audio. Apart from reflecting about the presentations we've just seen, Dr. Sook, could you also share more about the Children's Environmental Health Network and how they can support our efforts, particularly in the use of indicators in Asia Pacific? Thank you.
Okay. Thank you very much. Yeah, and I'd like to make a couple of comments too on the presentations, but the children, I've been working with the Children's Environmental Health Network, which is now going global. The director is a woman by the name of NC Witherspoon, and she's based in Washington, D.C. they are working on a climate equity collaborative, which is part of the Children's Environmental Health Network, but they are now launching the Global Children's Environmental Health Work. The programs that I've been running at NIEHS for a number of years have supported the Children's Environmental Health Network. In fact, we have a centers program that we've worked with for, oh God, for a long time that focused primarily on research. But now, considering the amount of research that's taking place in children's environmental health, whereas years ago that was not the case, it's now focusing on the issues of translation of those research findings. And NC, Children's Environmental Health Network, are part of a, what do you call it? A part of a cooperative sharing of data. In other words, all the data comes in. They're a clearinghouse, basically. And now NC and our group are taking this to a global level. They want to be able to take information and focus on children in the communities that are most vulnerable to climate change. They want to be able to infuse communities with opportunities and partnerships to address local climate change problems. They want to be able to, these are all issues that I think we all need to try to figure out how to embrace based upon the presentations that we just heard, but also to analyze and share solutions to specific risks that threaten the health of children from local effects of climate change. This goes directly to this issue of data sharing and the interoperability of data. I think it's important for us to consider the whole field, so all the fields necessary to be able to get these platforms to talk with each other, if you will. The other thing too is to be able to, I think it's important for different communities, underserved communities, all the communities that are out there, to have a voice at the international level. And I think this is something that the Children's Environmental Health Network is beginning to foster. And essentially the one thing that I'm also very interested in is to be able to grow the pipeline, if you will, of young environmental health researchers, advocates, and leaders. As a part of this too is I actually have started a nonprofit called ARCH, Advancing Research on Children's Environmental Health, which is the idea of being able to support younger environmental health researchers focusing specifically on children's environmental health. Anyway, so that's where I'm going with this. I think that I can probably put the, what is it? You got to realize it's 5 o'clock in the morning here. So I will put I'll provide you with, or maybe I already have the link for the Children's Environmental Health Network. They haven't totally gone global yet, but they will be very soon. They're establishing an international advisory board at this point in time. I was invited just yesterday morning. I was invited to be a part of that, and so with that, I don't want to take up any more time because I want to hear from other people. I do think that, and this is my own personal feeling on this, that as we bring all of this data together to address environmental health problems with regards to climate change, there are a number of children's cohorts, pediatric cohorts throughout the world. Some of them do talk with each other. There's very good ones in Japan. There's good ones in China and South Korea. There's one in Uruguay. It'd be nice to be able to get a listing, if you will, of all the children's cohorts, of all the birth cohorts, essentially, that started out as birth cohorts, and now some of the birth, like for example, the one in Japan started out as a birth cohort, and I happen to know that they've gotten additional funding from the government because these children are now in their teens. So they're being tracked throughout life, basically, because that's the only way that we're going to get a better understanding about what the overall health consequences are, because these cohorts give us a framework, a time frame to work within. Anyway, we could go on about this. This has been very, very interesting.
Thank you.
So I guess I'm supposed to be fielding questions, or you can, Lynn, go for it.
No, thank you. Those are really great ideas, suggestions, and points for all of us to follow up on. So we do have a couple of questions from the audience that I'm going to field to specific panelists. So we have a question for Dan Cass, and the question is, what can countries, or what can we do after a children's environmental health indicator system is established? Like, what is the next step?
Well, I guess I'm sort of interpreting this question to be about the creation of them, since there are sort of few examples of ones that are sort of created and mature. Will the guide that I've referenced in my presentation, and that's on me, sort of described as a collaboration between UNICEF and Vital Strategies, is a really good starting place for really looking at what countries can do. A good set of indicators is going to be based on a very well-developed data inventory that involves a lot of stakeholder engagement to find out about what data sort of agencies and institutions are sitting on that really can be mined for characterizing different aspects of the environment, hazards, exposures, levels of activity, governmental actions that are underway. So this inventory and stakeholder engagement process really is the sort of critical part of it. And I think my guess is that Fuyan would agree with me, since she's been managing, this network now that is sort of probably, I don't know, 15 or 20 years old, that's a kind of never-ending process, that there's always opportunity to continue to mine information, develop additional indicators, sort of invest in the collection of data at smaller and finer geographic levels. But the creation of a network to do so within any given country is really essential. Bringing people together who are data owners, but really importantly, data users to really guide that process is really, really important. And we'd be happy to have a conversation with sort of anyone about suggestions or ideas for any particular country's context. Thanks.
Thanks. So Fuyan, the next question is for you. In terms of what is the role of the private sector? Because we heard from Martin how successful he was with engaging the private sector. We want to learn if, in terms of the US, how have they contributed to the tracking system?
Yes, thank you for that question. I see a lot of opportunity to be able to engage with the private sector. Our programs predominantly engage with federal and national partners, partners at the state and local levels, and nonprofits. But I think, again, there's a wealth of information that I think, and data that I think would be an asset to the tracking network. We've spoken to some private sectors to begin conversations on how we can collaborate to be able to bring in relevant data for the tracking network and help to support the information, the data that we would like to disseminate. For example, one is electronic health record data. We're very interested to see if some of that data, for example, can be useful and also formatted in a fashion that is usable for the environmental health tracking network and can be visualized and analyzed alongside the existing data. So again, that's something that we're very excited about and exploring.
Thanks, Fuyan. And I've got a couple of questions for Martin. So, our experience working on this is that sometimes governments and other stakeholders are reluctant to make data widely available. And we would like to hear from you, like, how did you manage to overcome that fear or that reluctance to share data? The second follow-up question is, how did the Blue Map app manage to attract so much public attention and influence with the public and private sectors?
Yeah, thank you. Thank you for the questions. First, data is very, very important, but it can also be quite sensitive, especially when we got started in 2006 in China. So we decided that we're going to compile government-sourced data first. But the trick is that at that time, not much data available. The first year, we can only manage to collect less than 2,000 records of violations. So with that, we decided that we need to work on something more systemic to promote transparency. So one of the ways is to develop an index we call the Pollution Information Transparency Index, along with our partner NRDC. So with this index, we every year we assess the performance of 120 cities, and we continue to do that for more than 10 years of time. And through this process, help to identify not just the gaps, but best practice. And so gradually we have seen the change. And of course, something more important is that when the government decided to really try to embrace, try to change its course on environmental protection and put people's health, on top, first. So they realized that that it's actually better to use data instead of just having a pretty wild so-called participation. So they gradually understand that data, through our efforts, haven't really disrupted the society, but it actually helped to mobilize the stakeholders to come together. And that boosts the confidence in further disclosure of the data. So to put it simply, it's like that, but 16 years have passed. And then, but on the, of course, it is the power of the people. 2011, millions of people made their voice heard to demand for PM 2.5 data. When Beijing and the surrounding regions suffered from long stretch of smoggy days, when parents, including myself, got so concerned and anxiety over the health of my child. So this is the, I think, the power of the people, and the reason that we got so much attention. Unfortunately, part of that is because the pollution used to be right in the face. It's really, really bad. And but I'm happy that through all this data and transparency, we managed to facilitate a healthy interaction between different stakeholders. Before, the gap of distrust is so big, and that actually prevent the sharing and disclosure of all this data and the use of the data. But now, I think the most important is to, through the efforts to showcase that is actually helpful and can bring people together. It can make difference. When more blue skies are coming back, when the surface water, I talked about the water pollution, the year when we set up, 28% of the monitored water sections in China were in the category of worse than category 5, good for no use. And 2020, that year 2020, that indicator dropped to about 1%. So people can see the difference, when more data trigger more action and more collaboration. Of course, we're still not there. Mission is far from being accomplished. Most of our cities still cannot meet with the WHO standards, and it's far from being like that. So we have a long way to go. Yeah, thank you.
Thank you so much, Martin. I think you've achieved a lot already as well. And if you keep plugging on, I'm sure you will reach success in many other areas of China. So we've actually come to the end of the webinar. We don't have any more time for questions, but if you have a question or if you'd like to reach out to learn more, please do not hesitate to get in touch. With this, I'll just like to hand over the mic to Sidi Ariel, my our colleague and the Regional Director for Vital Strategies to just give us quick closing remarks.
Thank you, Lynn, and thank you all the panelists and the experts. It was a really lively and really enjoyable learning experience. So thanks to all of you for making it here. Unless we take corrective actions, children's health will continue to be threatened by environmental degradation and climate change. We all know it. But we also have reasons to hope and reasons to believe that countries across the Asia-Pacific region will welcome the development of children's environmental health indicators and other innovations such as this as a tool to address the environmental threats to children, particularly those experiencing high vulnerability and climate and environmental risks. So we are happy to support as Vital Strategies any governments and any other partners in the region to strengthen the national linkages between environmental health and also between public health through innovations such as this. Thank you all for making the time to attend this webinar, and look forward to interacting with all of you again. Thank you so much, and goodbye.